I recently got a call from a friend who called to tell me that a colleague of his had just been diagnosed with cancer. He was calling me with a question that almost probably everybody asks, and that is, am I getting the right treatment? Is this the right treatment plan? 1/3 of all treatment plans today do not meet evidence-based standards of care. 1 out of 3, 32%. So my friend was clearly aware of the fact that if we don't get the treatment right from the start, we don't give ourselves the best shot at beating cancer. Just a few years ago, oncologists had to make a few decisions in determining a treatment plan for a cancer patient. Today it's in the hundreds, and soon with personalized medicine, it'll be 1,000 decisions that an oncologist has to make just to get the treatment plan right for the patient. Now today we already see that the amount of information coming out and available to oncologists is far outpacing their cognitive abilities to keep up. So my friend calling me, he's really asking, can eviti help him? He basically called me because I have the extraordinary privilege of working with an extraordinary group of individuals who've set out to provide this answer, not only to my friend, but everybody who needs that answer. And a medical advisory board that stretches from Harvard to Cedars-Sinai. A dozen of some of the leading oncologists in the nation have come together and said, this is an initiative I want to be a part of. And eviti is independent. There's zero financial interest in the treatment plan selection. So let me tell you a little bit about how eviti works. When a patient and a provider are determining what is the best treatment plan for that patient, the provider and/or his nurses can access eviti via any browser. They'll enter the patient's information, including the diagnosis, and eviti will provide them with a list of evidence-based treatment options and the literature that supports those. The oncologist then can determine which of those is most appropriate for that patient. And once he or she has made that selection, an eviti code is assigned, and the payer is notified and gets transparency into the cost, the timing, the treatment plan for this patient. We have one clear focus, and that is to make the most comprehensive oncology decision support resource on the planet, to make it accessible by every oncologist to treat every cancer patient in the world. Because every time eviti is used, it reduces that 32% to 0.